Well, you bring up an interesting point there, Raj, and maybe you'd like to address the question of the impact of off and quality of life. What does off mean to patients?
Off can be, like I said, all the way from very minimal symptoms that we ask our patient, is it bothering you? Do we need to do anything? Is it functionally impairing you? And the patient may say, no, it doesn't. All the way to that they have a hard time dressing in the morning because they wake up and they're off, that they have to go to the bathroom, and because they're off, they cannot go to the bathroom. And when they are off, they have the urge to go, but physically they cannot go. So to me, it can really impact them on what they can do. And imagine this person working, if they are off 1 hour a day and that's right at work, that person cannot work for a whole hour from that part. So that can be very impactful. At times they go to the hospital and the nurses might think, wait a second, half an hour ago you got up and went to the bathroom and now you want me to come help you or help you dress. Well, that's what their off is, but the nurse might be thinking this patient has psychological problems that they're suddenly wanting me to give them a sponge or change them, but that's how much it can impact it. And then, of course, you have the psychological issue. They're afraid to go out because, if I go to a restaurant, I may go off, and I may not be able to walk back to my car, or I may not be able to drive back home. So to me, off can really impact a patient's quality of life. It can affect them physically, it can affect them emotionally, it can affect their work, and the other thing is it can affect their balance, and they may fall during an off time. So I think off is important, and it's more the severity of the off, how much it can affect the quality of life. And the other thing is we do know, there are studies, that the cost of treating Parkinson's is higher when a patient is having off, whether it's we are using more medications, whether a patient is more likely to fall and end up in a hospital, but that also impacts on the price of Parkinson's.
There are other costs as well. Patients prematurely retiring, right. Patients withdrawing from social interactions, patients having an increased perception of self-shame. This is a new area of research that's coming up, all because of the burden that they place on themselves and perhaps on their caregivers to stay in, to withdraw. So just carrying an on-demand therapy in one's pocket, even if not used regularly, can be an empowering tool. It's interesting from the long-term follow-up of the inhaled levodopa powder study, which reported that on average 3.5 off episodes occur during the day. The patients chose to only use it twice, but having that power to use it twice or whenever being off shows that empowerment, that perhaps that patient can return to the workplace or social situations with confidence that they can get back on in a satisfying and clinically meaningful way as needed within minutes, within 10 minutes or 15 minutes in some instances.
I think the emergence of on-demand therapy, and we'll talk about therapies in a little bit, but I think the emergence has given us the ability to fundamentally shift the treatment of Parkinson's disease. And you look, and I'm sure we all have these stories of things as common from patients, like they started to avoid physical therapy because they couldn't reliably predict that they were going to be on when they needed to. Or Stu, I remember you telling me about one of your patients, and I believe it was his daughter's wedding, where he suddenly was turning off at his daughter's wedding and was able to use an on-demand therapy. And just think about how awful that would have been. You talk about one of the great events in a patient's life, and sometimes we tell people particularly in the old days, well, just take an extra dose of levodopa. But we know taking the extra dose of levodopa is not going to do anything if it's sitting in the gut. We need therapies that can bypass the gut, and now we have these on-demand therapies.
This gentleman was so concerned about being able to walk his daughter down the aisle that he was planning to have a wide-angle camera so that when he took extra medicine orally and it would finally kick in, he knew he would be very dyskinetic and wanted to be in the frame, so he had a wide-angle camera. And just giving him the ability to, in this case, inject subcutaneously apomorphine, he was able to just time it, inject, and then walk down the aisle without having to worry about all these other problems.
Right, so these things, they may be small in the big world picture, but in that patient's life, it's a remarkable impact. And you could see, if he wasn't able to walk his daughter down the aisle, the quality of life impact that would have on patients.